All right, so welcome to the Dairy Good Dawgs, a place where we talk everything from the barn to the arch and where conversations are all things dairy, the people, the science, and the stories behind the cows. I'm Jillian Bohlen with Sophie Dupont, your host for today's episode, where we are joined by Dr. Emmanuel Rollin. Dr. Rollin is a clinical associate professor at the University of Georgia's College of Veterinary Medicine. He works in the area of food animal health and management within the Department of Population Health and Production Medicine Services. Many of us in the Southeast have you, Dr. Rollin, on our list as the go-to person for questions involving mastitis. Your practical approaches, as well as extensive milk quality lab, are extremely valuable to our producers. Therefore, really, the realm of discussions that we could invite you for is pretty robust. However, today we just really wanted to focus in on conversations regarding the use of antibiotics to treat mastitis, kind of the when and the why, and how we should best make those decisions. I think there's a lot of misunderstanding or just lack of understanding when it comes to tackling mastitis cases with antibiotics. And we look forward to you joining us for this conversation that I feel is very important to our industry today. So welcome to our show, Dr. Rollin.
Thank you.
So I know I gave you a very formal introduction, and I guess part of that introduction that I love the best is the practical approach that you tackle problems with dairy producers, which is another reason why I think you're such a great guest to have on this, is because we're very much practically driven. And so I gave you the formal introduction, but can you just tell me a little bit more about what you do at the University of Georgia?
Yeah, so my job is to prepare our veterinary students to enter veterinary practice and make an impact on their clients' operations or the industry as a whole. So my focus is on dairy production and dairy production medicine. And so I do that by mostly taking senior veterinary students, and taking them to farms and showing them how they can help the producers. I also do a little bit of classroom teaching. I also support veterinarians in the field and other operations, but I kind of have a small client list that I go to frequently, and most of the time I have students tagging along with me.
Yeah, that's so important that our students get that practical hands-on approach and not just the classroom understanding or background. So appreciate that. And I know you work with a lot of producers, as we were talking about earlier in our pre-conversation. I was talking with a producer yesterday who had already worked with you on some of the milk quality analysis and some of the pathogens that might be affecting their operation. And so as we talk about that, in your milk quality lab, what are probably some of the most common things that you see right now, and are, they tend to leaning environmental, contagious, swing of both? What are you seeing?
Yeah, I'd see most of the bugs that are in the textbooks. I see them eventually. The most common would be the environmental streps. They're the ones that seem to thrive, especially here in the Southeast, in our humid and warm environments. Those are the ones that are challenging to manage for our cows. So a lot of streps, a lot of E. coli's, and then a fair amount of Staph aureus. We seem to have Staph aureus here in the Southeast a lot, and it can be a challenge to manage also. The other thing I'm seeing more of is Prototheca, which is an emerging mastitis pathogen. It's not a bacterium, it's a achlorophyll algae. So we don't really have much that we can help treat things with, and it's a challenge for the cow to get rid of it. So Prototheca is one of those, I guess we call it an emerging pathogen. It's probably been around longer than we like to think, but it's one that's been a challenge in the last 5 to 10 years.
Yeah, so definitely the environmentals, given our conditions here, and then a lot of staffs, you said the Staph aureus. Do you feel like some of that, and this is a little bit off of our topic, but do you feel like some of that is just us not culling maybe as aggressively for some of those cases, or do you feel like it's something else with the Staph aureus?
Potentially. I feel like the more I know, the more I see, the less I understand about Staph aureus. In the textbook, it's one of those. It's a chronic. Once a staph cow, always a staph cow. It's like a progressive thing. She's always going to have high somatic cells. She's always going to be a problem. But I see some cows that just seem to have this slow, smoldering infection, and it just kind of pops up here and there, but it doesn't cause a lot of issues. So I think within the Staph aureus family, there's a lot of different bacteria that behave differently, and we lump them all together. So some of it could be, we learn to live with it, and we're okay with some of it. The other issue we have here in the Southeast is flies, especially in heifers. So breeding age heifers all the way to right before they calve, flies will transmit Staph aureus from one heifer's skin to another heifer's skin, and then it can invade the mammary gland if we have not very good fly control on those heifers.
Yeah. Thank you for that insight. I know we always have some Staph aureus cows, and the conversation is whether to cull or not. And some of them, they're good cows that it doesn't really seem to be affecting them in the same way. So that's just why I wanted to go off on that little bit of a sideline to see what your viewership was on that. Now, as you listed kind of that list of environmentals, Staph aureus, the emerging prototheca, would you say that there's a high level? So when a farm sends you samples, do you feel like there's a high level of variability between farms, or do you feel like it's all the same stuff, it just might be distributed a little bit differently?
Probably somewhere in the middle. We have some farms that seem to struggle with certain bugs or certain strains. I've had some farms that struggle with a bug we call lactococcus, which we used to group with the environmental streps.
Mm-hmm.
Some farms seem to struggle with prototheca more than others. But then I also see kind of a seasonal changes within farms. They may struggle in the spring with E. coli when things get muddy and wet, or in the summer when we put water on cows to cool them, we may see more E. coli in those cows. But I think overall it's kind of the same general categories with a little bit of variation from farm to farm.
Mm-hmm.
That's interesting. I'm going to chime in here, Dr. Rollins. So, no matter what an operations pathogen profile is, do you think that producers can kind of be skewed on how they approach those treatment decisions based on what they have on their operation?
Definitely. And sometimes that's a good skew. If a farm has a string of very severe mastitis cases, they're going to be a little bit they're going to jump to drugs and a little more aggressive treatment faster, which can be good. But yeah, definitely would affect how they treat, and sometimes that's good. Sometimes they're a little too aggressive. It just kind of depends.
Yeah, and I think that ties in, right, directly to our conversation, because antibiotics, I think, in the food animal industries are just a hot topic, or they're kind of a persistent conversation, right, our usage of antibiotics. And I think a lot of people likely attack a mastitis infection with antibiotics head on, just kind of worried about the implications should that infection persist. What would be your thoughts on why this isn't always maybe the right approach? So in other words, when I see a case of mastitis, I'm going to hit her with antibiotics straight off the bat. Why is that not always the right approach?
Yeah, when I talk about intramammary antibiotics with students, I remind them that the cow has an immune system, right? And the antibiotic is just helping. So helping control things while the immune system can catch up. And so it may not always be needed. Sometimes the cow, based on either cow factors or pathogen factors, does need help from antibiotics, and that would, reduce the chances that it will get more severe, or it may reduce the chronicity or speed recovery. And so, knowing the cow factors and the pathogen factors helps to make sure we do the right thing. And sometimes waiting is the wrong thing, and sometimes waiting is the right thing. But we don't always know what that is. And the antibiotics we have here in the U.S. currently are all fairly similar in their activity. So they're beta lactams. They have pretty good gram-positive bacterial spectrum. Some of them have okay gram-negative spectrum, but they're all just a little bit of help for that cow's immune system. So they're not magical. They're not they're not going to completely get rid of the infection. They're just there to kind of help that cow. When we consider antibiotic use, one of the things we're worried about is resistance. So do we select for pathogens that are going to be resistant to those antibiotics in the future, or can they share that resistance with other bacteria? And so that's a big challenge. In mastitis, what we do usually is treat locally. Right? So we use intramammary drugs that go right to the site of infection instead of systemic drugs where we would treat the cow and we're treating everything in the cow, right? So some of those drugs can have an effect on the gut bacteria in the rumen. We can have an effect on all the bacteria that cow touches. But with intramammary antibiotics, we're only exposing the mammary gland. So we have a small amount of exposure and we leave all those other bacteria free to not be exposed to the bug. So that reduces the chances that we're seeing resistance in our mastitis pathogens. And there's been studies over time that look at resistance in mastitis pathogens, and there hasn't really been a change over the last 15, 20, 30 years. And so that's a good thing. Mm-hmm. The other concern with antibiotic use, of course, is cost. So that the cost of the drug, but then the cost of the milk withdrawal. So when we treat a cow with intramammary antibiotics, we have to, we're going to treat for several days, and then after that, we have to follow that milk withdrawal time. And so all that milk now is not saleable, and so we're losing potential revenue from that milk. And so just jumping to antibiotics every time, we're going to incur the cost of those drugs and the milk withdrawal. Whereas for certain cases, if we wait, we're going to save money on the drug, and we may save some money on not having that non-saleable milk.
Yeah, and when you think about this, I think we all have our kind of our gold standard, right, of how we would like farmers to deal with mastitis, which is, test, don't guess. We need to culture, figure out what we're dealing with. Sometimes, we can achieve that. Sometimes we can't. Maybe it even is cost prohibitive. So do you have any thoughts on if I'm a producer that is not going to culture for whatever my rationale is, I'm not going to culture, do you have any kind of just general rules of thumb on when to use versus when to not, whether that's off a somatic cell count or whether that's off of a clinical infection signs, or is that too open-ended of a question to kind of answer?
No, it's good. The first rule I have is if a cow has what we call grade 3 or severe clinical mastitis, where she's got abnormal milk, her udder is abnormal, and then she has systemic signs like fever or inappetence or dehydration, she needs treatment now. So that's one case where we don't wait to culture. She needs systemic antibiotic treatment to protect her from dying or having, severe consequences. So those grade 3s, those severe cases need treatment now. The grade 1 and 2, so abnormal milk and potentially an abnormal udder, they can wait. 24 hours is okay to wait. That infection has probably been brewing for several days or maybe even weeks. And so waiting 24 hours for an on-farm culture, or if you have a very local lab that can get that cultured quickly, we can wait on those and then, based on the culture result, decide to treat or not treat. If we don't have cultures, one of the things we can look at, like you said, is her history. What's her somatic cell history? If she's one that, in the past we've cultured Staph aureus from her, she's had high somatic cell counts forever, we've treated her 2, 3, 4 times before, that's one where I don't think antibiotics are going to help anymore. We've tried that. The infection has been chronic, and so that's one where you may skip antibiotics as long as she's a grade 1 or grade 2. We seem to have cows that are younger seem to respond better to antibiotics. Cows that are older, seems like the risk of cure is a little bit lower. So that's another one we can use is the cow age. But good records are definitely important before jumping to that.
Yeah, and I think Sophie's getting ready to pop in, but I will say I love the records piece, right? Is you got to kind of know that cow's background to figure out, is this something we've dealt with repeatedly? Have we been hitting her with the same antibiotics? So I appreciate you throwing in that records piece. I think that's a really good one. Sophie, sorry I interrupted you. You jump on in there.
No, you're good. I'm like jumping out of my seat with excited about this question I have. Yeah, those are some really good guidelines. I was just wondering, if I'm someone who's always turning to antibiotics at clinical signs, maybe not that grade 3 or those severe cases when she really does need them, but maybe even in those grade 1 or 2, if I'm someone who always turns to antibiotics kind of no matter what, even if I do or don't culture, are there any issues you could see long-term or that you predict long-term or that you have seen on operations that you work with?
I guess the scare for antimicrobial resistance in mastitis pathogens to me is not, as far as I know now, we may have data in the future, but as far as I know now, that's not a real threat. So I'm not scared about creating resistance. But every time we use an intramammary drug, we're sticking it through that street canal, and we're potentially pushing other things into the quarter. And so farms that are not very clean or get in a hurry when they're treating cows, those are ones where you may see some weird pathogens pop up, things like yeasts and protothecas and potentially a bacillus, or just from the trauma of sticking that intramammary tube through the street canal and potentially pushing other pathogens into there that the antibiotic isn't going to cure. And when we treat cows and we have them in a hospital pen or separate, they're that environment with other sick animals, we could have other diseases spread between those animals. So if a cow is continuously going to the hospital pen, she's moving pens, she's changing diets, and then she's around all those potentially other infectious diseases. So that cow would not be a good long-term producer if she's always in that hospital pen.
Interesting. Okay, so it's less of the antibiotic resistant piece and more of that introduction of disease or trauma to the udder, or spreading diseases between cows.
Yeah. Yeah, now if we're using systemic antibiotics, then we do have the potential to expose respiratory pathogens, GI bugs, all those to resistance. But when we're just using intramammary drugs, that reduces that risk for me.
Okay, that's a good distinction.
Yeah, and I had honestly not even thought about the pen change piece. That every time I treat her, she's going back in a different pen, and possibly with some animals that are vulnerable. And she's likely vulnerable. So yeah, the disease transmission, I literally had never thought about that piece. So I love it.
And there's the social stress of that for her also. She's got to make new friends
and that's difficult for some of us.
Maybe in the pen with the mean old cow.
Yeah, and if she's trying to combat an infection and now has this social stressor, it's going to be even harder for her to do that. Yeah. Yeah. Huh? Yeah. The things you learn. So, we've talked and we've kind of hit on the culture piece. I don't want you to give any antibiotic recommendations because I know everybody should work with their veterinarians to decide what that piece is. But let's say I wanted to try culturing. I'm not fully vested. Are there particular cows or cases or timelines or days in milk where I should try to implement that culturing where it would be most effective for me?
Yeah, the place I would start is culturing cows with abnormal milk. And so It's not going to be a lot of samples, hopefully. Um, it,
Mm-hmm.
there are some systems out there. One is from the University of Minnesota. They have the easy culture system where they'll, it's kind of a one shop. You get all your plates. They have a really good guide with pictures of how to do the treat, no treat with the biplates. Starting there, pretty simple, a small investment. You can have one of those egg incubators that's fairly inexpensive. The main thing there is to have somebody who's dedicated to it. So if someone's still on the fence or they're kind of pushing it off to one of their employees that's not interested or invested, it may not work very well. But having somebody that's interested and does it, and I've got farms where they have, and he does a great job, or a regular employee doing it and they do a good job. But if you're not clean in the way you take samples and run the little lab, it may not work very well.
Mm-hmm.
And then I've got farms that are screening fresh cows looking for contagious bugs. So screening heifers when they calve to look for Staph aureus, or screening maybe cows with high somatic cell counts, or cows with multiple cases.
Mm-hmm.
And it doesn't have to be the overnight one day thing. You can collect samples from clinical cows and begin treatment, and then send that milk off to a local or distant lab and get results afterwards, which will then inform if she gets another case, or maybe help you decide whether she needs to stay in the herd or become a beef cow.
Yeah, that second career opportunity, right? Yeah. Well, this has been very informative, because I'm not going to lie. When we first got onto this, I thought the antibiotic resistant piece was going to be a primary point of conversation. But I think in listening to you go through this, there's so many detailed little pieces that we probably get barn blind to, that we don't think about when we're dealing with antibiotics and treatment decisions. Going back to that concept of she has a pen change because I decided to treat her, and that it's not just the cost of that antibiotic, it's the cost of the dumped milk, and that if I'm treating the same cow over and over and over again, there's a point where there's that old saying that I will skip, but if you keep doing the same thing and expect different results. But I think that all of that is very good information and often overlooked when we think about treating mastitis. And I think that probably a lot of times the antibiotic piece kind of makes us feel better in that moment, right? That we feel like we've done something to address the situation. And I think you've given us a lot of great information on why that could be a good approach with certain situations, but maybe what are some alternative ways of thinking, as well as points of investigation before we make those decisions. So, Sophie, do you have any other questions before I give it to Dr. Rollin for our final tips, points in this discussion?
No, I promise I won't interrupt anyone. I just so appreciate hearing. Yeah, I'm the same with you, Dr. Bohlen. I really thought that the antibiotic resistance was going to be, our big piece here. But I think thinking about these smaller, more nuanced details when it comes to each different operation, and just the, the stress that the cow can be under when it comes to infections is really interesting.
Yeah, when we talk about resistance, either in like GI parasites, one of the things we talk about is refugia, and those are the parasites or the bacteria or the plants that aren't exposed to the thing they're going to become resistant to.
Mm-hmm.
And so when we treat an animal systemically, everything gets exposed. There's no refugia. But when we treat locally, there's a lot of refugia, especially in the environmental bugs, because we're treating 1/4 of one cow, and those environmental pathogens are just everywhere. So we're not really pushing them towards resistance. And in GI parasites, we talk about not treating every animal, so that some of those parasites are the refugia. They're the ones that are going to make the eggs that then are not resistant.
Yeah, I love it. So I know that we've pummeled you with a lot of different questions to tap into that brain in your mastitis knowledge. But, there might have been some points or pieces we didn't bring up. Are there any final conversation points, tips, tricks, rules of thumb that you want to share with us before we leave?
Yeah, one of the things I I like to teach students is that the mammary gland is a really special place. It's a weird organ that mammals have, a modified sweat gland, which makes things delicious. But it's a really hard place for the immune system to work, and it's a really different place for drugs to work. And so when we think about other types of infections like pneumonia or skin infections, the pharmacology and the host pathogen interaction is very different in the mammary gland. And I guess I like to think that sometimes we just need to give up. That gland is not necessary for the cow. And I think it's designed, the cow has 4 distinct quarters that don't communicate. And she usually only has 1 or 2 calves. And so I almost think it's designed so that if one quarter ends up with an infection and, it won't spread to the other quarters, and she still has a way to feed the calf. And so sometimes giving up on a quarter may be the right thing to do, and keeping those other 3 quarters. And so sometimes giving up is okay with mastitis, just knowing that gland is designed to make milk, and is not designed to protect itself at all costs.
Yeah, I love that final piece. Students always ask me that. Why do they have 4 when they only have 1 or 2 calves? I finally have an answer for them.
Yeah, it's designed that way. And maybe that's a little bit more philosophy than science.
We're here for it all.
We appreciate it either way.
All right. Well, thank you very much, Dr. Rollin, who is with the University of Georgia College of Veterinary Medicine, and of course, a really valuable member of our dairy community. Conversations like today's remind us that the future of dairy is built on a lot of things. One of those is understanding. And people who share ideas, ask questions like we did today, and worked together toward progress. If you enjoyed this episode, please share it with someone who could benefit from us. And thank you for joining us. Tune in next time for more from the Dairy Good Dawgs, because every great glass of milk starts with great people.